Hi, and welcome. Thank you for joining the American Association of Kidney Patients for our 45th annual National Patient Meeting. My name is Dammeon Marshall. As a social worker, I have always expressed a genuine interest in helping people. While in my doctorate program in 2012, I was diagnosed with chronic kidney disease. I went through a period of grieving, and the mere thought of experiencing kidney failure, it caused feelings of hopelessness, helplessness, confused, and I was actually a bit scared. The emotional and psychological impact caused me to internalize, to worry, to question my worth, my vitality, and my destiny. And roughly about October 2016, I made a conscious decision to push forward to enroll in my doctorate program in social work. So in 2019, while attending the AAKP National Patient Meeting in Washington, D.C., I had an opportunity to learn how to manage the disease. But not only how to manage the disease, I also met similar people who were experiencing some of the things that I was experiencing. This process assisted me with discovering my purpose. And so, guess what? I became an AAKP ambassador. And so now, here I stand before you today. So, again, I would like to welcome you. But my journey did not stop there. Today, I've been involved in a number of initiatives. And one of those initiatives is working with the AAKP Patient-Centered Outcome Research Institute Dissemination Award on peer-to-peer mentorship. I'm excited about it. Most of my life, I provided to support to others, but now I am in a position where I can receive support myself. So today we have two great presenters. First, we have Miss Ashley Martin, and second, we have Mrs. Bobbie Reed. Each of these individuals are very outstanding individuals in our community. They have established platforms of voices for kidney patients in their own care. The great customer service choice by advocating for new medical interventions. Let's talk about Ashley. Ashley is a caregiver, an advocate. She is also studying at the University of Cincinnati. After a recent change in her major, she is now studying biological sciences with a concentration in biomedicine and minor in chemistry. Go, Ashley. In addition to that, to pre-med, she's actually on a pre-med fast track. She hopes to become a pediatrician and work doing pediatric transplant as a surgeon at Cincinnati Children's Hospital. She has been a caregiver for a mom since the age of 7. She also has been attending AAKP national patient meetings since the age of 8. As AAKP Ambassador, she has represented the organization and interests of the kidney patient and family unit to members of Congress on-one and virtual Hill Days, as well as presented a number of AAKP meetings and contributed to the AAKP Renal Life magazine. It is now my pleasure to welcome Ashley.
Welcome to the American Association of Kidney Patients National Meeting. I'm so excited to be speaking with every one of you. It's such an honor that I was asked to speak on a topic for disease management. So let's get to it. My name is Ashley Martin, and I am a caregiver. And this session is called Caregiver Corner, and we'll be speaking about skills that you could utilize and different things that I felt have helped me throughout being a caregiver. And just some different strategies that hopefully are pretty helpful to you, and a little bit of my perspective of being a caregiver. So like I said before, this is the Caregiver Corner session. First of all, I want to commend everybody that's attending this, that's a patient or a caregiver or watching for a friend. I know sometimes battling this disease, everything's changing and it can be so difficult, but you'll get through it, and hopefully these tips can help you. So a little bit about me. I'm actually from Cincinnati, Ohio. I'm in my very last semester ever at the University of Cincinnati, which is super exciting that I'll be graduating in December. And I'm an advocate, I'm an activist. I did a lot of work in Congress and a caregiver. So what does all that mean? So I'm actually a field ambassador for the American Association of Kidney Patients. I also work on their speakers bureau. So what that is some companies or organizations will contact AAKP or go on their website and request me to speak for them or speak about something related to kidney disease. There's a whole facet of different topics, but essentially just to raise awareness or give perspective or to teach about different things related to kidney disease. I also work with several nonprofit organizations, including like the American Kidney Fund, the National Kidney Foundation. And I also work a lot on Capitol Hill. So that means I've worked with different organizations like the American Association of Nephrology, the Renal Physicians Association, and basically what I do is I work with different congressional members or legislative aides on different bills that will affect patients with kidney disease or their caregivers. And to me, that's just been such a rewarding process. I don't really even know how to describe how incredible it is, but it's a lot of work, but it's something I really enjoy. But first and foremost, I'm a caregiver. My mom is on her second kidney transplant, which we're very blessed with. We've done home hemodialysis, peritoneal dialysis, and fun fact, I've attended my first AAKP meeting at age 9. My mom found a pamphlet for AAKP in the corner of a chair at a dialysis center, and this was when Google didn't even exist. So we didn't know a lot of options about treatment options. We thought this was our only option, was to do hemodialysis. We had no idea you could do it at home. And so we went, and my mom was like, you don't have to attend any sessions. We're still going to do normal things like a family would on vacation, but feel free to if you would like. And I was hooked up my first session. I just loved learning more and more and be more educated about the disease. So as I said, I'm in my last semester at UC, and I'm about to graduate. And I've spent most of my time focusing and studying healthcare communications, pre-med, public relations, medical humanities. I also did a really cool internship with a company called IROC, and it stands for Improving Renal Outcomes Collaborative. And they are actually based out of Cincinnati Children's Hospital, and they're a learning network. And that experience has taught me so much. They do a lot for patients, and they do really cool things like making a coloring book that explains rejection to kids. So I'm so excited that I got to have that experience, and hopefully I can use this knowledge to make things better for kidney patients. So a little bit about my experience as a caregiver. It's not always been like the easiest of times, and I think being a caregiver can be something really difficult because initially it's something that's such an easy decision for most people to make. Like, you want to be in there, you want to step in for your loved one or your friend. But there are so many things that I don't think you necessarily anticipate that you may experience. One of those things for me was trying to have some kind of balance or control. This disease is rapidly changing, and you never have control of everything that's going on. And in fact, I feel like it makes life even more chaotic, and you feel like you have control over nothing. And so for me, learning how I could have some kind of a balance of living a normal life and being a caregiver was really essential, because when I felt like everything was rapidly changing and I had no control, it felt kind of like a hot mess, and it gets really stressful and emotional. So having things that make you feel like essentially it's normal life, normal things, you have some kind of a handle on what's going on, makes it a little bit easier. Another thing that was really difficult for me is because I was so young, a lot of doctors didn't take me seriously. They wouldn't keep me involved in my mom's care. Most of the time, they didn't even let me know what was going on, which when your mom is in ICU and she's not responsive, what are you supposed to do? And how are you supposed to act and prepare? You need to know those things, and you need to be seen as a serious role in their care, because when they go home, you're there for them and you're there to help them. And if your doctor can't see that you're a serious part of the team, that can raise some issues. And learning when to step away is really important, because there are times when you need a break, and that's okay. when it feels like it's too much and you're getting a little bit of anxiety or feeling upset or tired or exhausted, it's okay to put your foot down and say, you know what, I need a break from this. And that's totally normal. So, what are some effective skills that we can utilize to make things a little bit easier? Well, creating a regular schedule is important, establishing boundaries, and prioritizing your happiness. You need to have a good mental health. It needs to be you need to be able to take care of yourself foremost, because you cannot take care of somebody else if you're not taking care of yourself. And making a crisis plan. That way you kind of have something in place so that, when it's time to step away, there are people that can help you with that. So the first step, I would say, is making a schedule. For me, I'm a really type A OCD person. So for me, that's a very detailed oriented schedule. But my biggest thing that I felt was difficult in being a caregiver for my mom is trying to balance working and all the doctor's appointments. I mean, transplant clinic visits and things like that, they're just never scheduled around a good time, to be honest with you. They're not taking into the account that you have to work. It's, they need to go get their labs drawn, things like that. So it was really chaotic if we didn't have a schedule kind of established, because then appointments would start to be scheduled, and a lot of times they were things I would have to take my mom to, and then it's like, well, you have to work, so there's no way I can make that, and it just makes things even more chaotic and stressful. So this is kind of an example of what I would recommend for a schedule. I feel like I like everything to be super color coordinated and organized, but really it could just be something that you write down in your planner on your phone. It doesn't have to be anything too complex, because if you're spending so much time on those little things, then you're probably not going to be able to get enough time for yourself. And that's one way that you can be taking for yourself and doing something for you. Another thing that's really essential is establishing boundaries. There are some times where you have to communicate those boundaries because not everybody is going to understand that they're overstepping. One of those situations for me was that when my mom got her second transplant, it was during my finals week in college, which was incredibly chaotic and stressful. And, there's no plan for a transplant unless they're like a living donor, and that was not the case. So her donor was a cadaver. So we literally found out very urgently, had to rush to the hospital. Suddenly it was like I had to take care of the whole household by myself, take care of the pets, try to figure out how I'm going to work and make sure I'm watching after her. Because for me, I feel like anytime she's gotten a transplant, the surgery is really stressful. It's scary. The whole process is chaotic. That's just how it is. And there's still a beautiful thing, but it creates a lot of stress. And her social worker had called me. This was after the surgery, and called me about 2 p.m. And they were like, well, you need to go pick the medicine up from the pharmacy, and you need to come down here by 5 p.m. because we're going to discharge her today. And you need to get that done because you need to go over the transplant meds. And for me, I felt at first I struggled because it was like, how am I supposed to tell somebody that's not a realistic expectation? I am trying to do exams. I'm trying to take care of my mom. We've been through a transplant before. There are just these little situations that might arise, and really it's not okay for people to have expectations like that. And it's just learning how to communicate that. So for me, it was saying, I'm sorry, but right now this is what's going on, and we're trying to adapt to this transplant. And we've been over these meds. Is there any way you could go over this at a later time with us? And I mean, doing it in a respectful way is essentially what's necessary, but learning that you have to establish those boundaries, because if you're the person taking care of your loved one and you don't establish them, people are going to think that they can do things like that and tell you how to do things. And that's not necessarily okay. Also, prioritizing your happiness is really, really essential. There are times being a caregiver that your mental health suffers a lot because you're trying to care for somebody, and it's like a full-time job in addition to whatever else you have going on in your life. And so eventually it's going to take time, but you have to learn how to kind of step aside and be like, you know what, I need to do this for me, or I need to make time for myself, or maybe I should speak with a therapist and have somebody to talk to. It could be a friend. Just making sure that you're taking time for yourself, because it's so easy to get caught up in all these doctor's appointments and trying to do everything that you're so exhausted, and then you're not even happy. And you're not on this earth to just be a caregiver. You're here to do amazing things in the world. So you need to make sure that you give yourself that time to respectfully have a good quality of life. And it's really important that you establish a crisis plan. That way, when it's time, you can step away and you can say, you know what? Okay, can you take them to this appointment because I do need a break, or I'm exhausted. And so learning how to even just take the step and make a plan is really important, because a lot of the times when I needed a break, I realized that I kind of waited till the last minute and I didn't let anybody know that all this stuff was going on. Or I haven't really talked to these people to see if they could actually even help me out in a while. And so maybe if I had tried to communicate better, I would have gotten more of a break, because then it's kind of, you face this like urgency and you're like, all right, I don't know. I don't know if I should call them because I might disrupt them. No, like having something set in stone really helps make it easier, so you can just be like, you know what, how we talked about sometimes I might need help. This is one of those times. And then it just kind of opens it up and makes it a little bit easier of a process than feeling like you're a burden. Just having that clear communication is really nice. So this is kind of an example of a crisis plan that I developed. I think it's really important to reevaluate every 6 months. Just like everything in the world is rapidly changing, their care is changing, all of that is changing. So there's just good things to kind of consider. Again, you don't need to be so detailed, but I find it's a lot more effective when you do kind of have the details figured out, because then it's like, okay, these are the people I'm going to talk to. These are the strategies. This is when I'm going to implement it. Because a lot of times I noticed if I didn't have everything detailed, I'd be like, well, maybe I should not do it this time. Maybe I'll contact them next time. And then like you're on this endless cycle of being exhausted, and you've never taken a break because you're so afraid to actually take this step, or you really don't know how to take it. And so having something written out just kind of gives you a little reaffirmation that, okay, this is what I'm going to do. So, write out, when are you going to put this plan into effect? That way, like these are the line for me stepping away and taking a break. These are the people I'm going to call. Hey, this is who I'm going to call if I need a break and I need them to take her to a doctor's appointment. And these are the strategies I'm going to take. It's important to do some like deep breaths during a time where you're really stressful, doing some meditation for your own well-being, or going to therapy. For me, that really helped, getting to talk about what I was experiencing to somebody that's not going to be biased. That was very helpful. Or just taking some time for yourself, hanging out with a friend or going to dinner. That was really helpful for me as well. And just making sure that you have boundaries, because it just becomes so overwhelming. So these are the days that I'm going to be able to schedule doctor's appointments, and these are the days where I have to work. And just having those boundaries makes it a little bit easier for you. So I really hope some of these tools were really helpful for you. I love just connecting with patients and family members, and trying to make this world better, because I think there are so many things we can do from an experience, right? You can take your situation that you've been given and you can make something better for somebody else. And this is definitely an unusual situation that I was given, but I want to take the things that I have learned and make it better for somebody else, so that hopefully they don't have to go through so much. So feel free to connect with me there. I'm sure you can also get my email address from AAKP, and I would love to connect. If you have any questions, if you want to chat, feel free to let me know.
Thank you, Ashley, for that wonderful presentation. I have a question. So, you have witnessed variations of related kidney disease concerns. Can you share with us your concerns for those you've helped and how patients can reduce stress for their caregivers?
So that's a great question. I feel like questions I would have had for people who helped me. So I think I was put in a very unusual circumstance. I had to overcome a lot of challenges. And I think sometimes I felt like people didn't understand. Um, for example, when I got tested to donate a kidney to my mom, I wanted to be her living donor. I had just turned 18. I went on my birthday. I was excited. I wanted to do this for her. And there was just this constant like pressure. Um, I'll never forget. It was like sitting in a meeting, but it didn't feel like a meeting. It felt like an interrogation room of people like, well, she's forcing you to donate. And this is going to be painful. And basically trying their best to convince me that I shouldn't do this. And then being told, well, we just think you're too young because you couldn't convince me otherwise. Because the truth was, I had the best intentions and I was a perfect match. And I think there are some times that, you obviously have no control over those events and the decisions people make, and that's totally fine. But I think a lot of the time there was this barrier between the fact that I wasn't a spouse, I was her child. And a lot of people in the healthcare field had not seen that before. They'd always seen it be a spouse or a friend, but never a young child. And so I think a lot of the times I went through wishing that they had maybe put themselves in my place, because I don't expect anybody to necessarily understand what I'm going through all the time. But, when you're making the steps to donate to your mom, I mean, it's something that matters and it's something that's really important. So to kind of, treat somebody that's really doing it out of the kindness of their heart, um, and like be totally like treat them basically like they're the hostage or in jail and make it a really uncomfortable experience, it's not okay. And I understand they want to make sure that I'm have the best intentions, but it's not okay. You know, that person is already going through enough. I was 18 years old and I had to fill out a power of attorney form. Nothing in the world could prepare me for that. I didn't have anything really that I owned, and having to make those decisions about if something happened to me was really hard. And to answer your question about what you can do to make it easier for your caregiver, I think the biggest thing is open communication. There's so much going on, and their condition is rapidly changing. So I really don't try to ask too much of my mom or recommend that caregivers ask too much, because at the end of the day, they're dealing with this disease and it's changing all the time, and you're just doing the best you can do. And that's all anybody should ever expect. Um, but there were a lot of times where she would forget to communicate things, and it made it really difficult because I was trying to work. I was trying to go to school. So if you schedule an appointment on the wrong day and I can't take you and I really needed to take you, it becomes, stressful, it becomes difficult. So just making sure you're having that open communication, even if you told them once already or you can't remember if you told them, just making sure that you're communicating makes it a lot easier and a lot less stressful, because then you have a least likelihood of things rising. And I think the other thing would be just advising your caregiver, like, it's okay to take a break. Because I had this habit of I would just wait till like I was extremely stressed out and struggling and depressed to take a break, because I felt like I needed to help my mom in every way possible, because I just wanted to. That's what I wanted to do. I wanted to be there for her. She's my mom, and rightfully so. But I think sometimes a nice thing a caregiver can do, and even the caregivers can do this for the patient, because they're going to need a break as well, is just being like, you know what, you should go out with your friends this weekend. You should go to that brunch. You should do this. You should take some time to yourself, because you don't need to wait until you're struggling. You can actually be proactive and take some time for yourself, and you can be in the greatest mood possible. And that's fine. You should have those times. And both the patient and the caregiver should have those times.
Thank you, Ashley. Our next presenter is Bobbie Reed. Bobbie is also a caregiver advocate. In May 2013, when Bobbie's son Alex was diagnosed with kidney failure, she became his caregiver and biggest advocate. It took nearly a year adjusting to life on dialysis, learning to navigate through the insurances, figuring out Social Security disability, and learning the Medicare practices and policies before Bobbie began to search for a living donor. Guess what? She got a response. Penn State University Office of Alumni Relations Alatuna published a newsletter on Alex's need for a kidney donor, and an alumnus who read the articles was tested and found to be a match. On November the 9th, 2015, he was donated a kidney to her son. I welcome and introduce Ms. Bobbie Reed.
Hi, my name is Bobbie Reed, and I'm from Pittsburgh, Pennsylvania. I'm married with 2 children, and I am going to talk to you today about caregiving and how it's important really to take time for you. Like, what about me? I'm a mom, I'm a caregiver, and I'm an advocate for kidney patients all over. I have a family, I have 2 children, and I'm married, and I'm a graduate of Indiana University of Pennsylvania, where I managed or majored in family consumer sciences with a concentrate in business and economics. And previously, I worked for AT&T for over 20 years in various sales and marketing positions. Um, from there, when our kids started getting a little older, I transitioned into our family insurance agency, where I now handle our office management, marketing, and focus on selling life insurance. When my son became ill with kidney disease, I jumped into action as any mother would do. I became his primary caregiver and chief advocate. Alex, our eldest son, graduated from Penn State University in May of 2013. He was a student athlete playing on the baseball team. The real intent was for him to come to work in our family-run insurance agency. But just 2 weeks after graduation, he developed very high blood pressure, which led to complete kidney failure. In a short 5-month period, he crashed into dialysis and endured that for the next 2 years until I found him a non-related living kidney donor. His donor was a 57-year-old man from New Jersey, also an alumni from Penn State. And he wanted to give back. He wanted to lead by example. So he gave Alex his kidney. Alex got his kidney transplant in November of 2015. And we still have ups and downs, and each day he continues to fight to keep his gift of life kidney. You got to remember, kidney disease and kidney transplant is just a treatment. It really isn't a cure. So we are on a journey. Many of us have been there and done that in reference to dealing with many things that kidney disease throws at us. And sometimes we just need a hug. No words, no advice, just a hug to make you feel better. When you've completed these issues and those things that we face every day, a very large barrier is created. It's hard, and often others don't understand. For example, we had dialysis for 2 years, 4 days a week, getting on a wait list. You ask your questions constantly, why and what caused this? Navigating the system, finding a donor. And even after transplant, like I said a minute ago, it isn't over. All while you're trying to keep a job, maintain a household, keeping the family unit together. Then you have the emotional drain and the fear of everything and losing it all. The AAKP and other kidney organizations are terrific resources for us. An amount of information comes out of there, and a lot of resources are available to you to go back and ask questions of, or where to find answers. One of the other areas that I found extremely helpful was social media. Within social media, you have, let's take, for example, Facebook. You have a search box. From there, a lot of times what I'll do is I'll search in that search box for like caregiver and transplant, dialysis, organs donors, that type of thing. And it brings up different groups that you can actually ask to belong to, that you can ask questions of, or even a lot of times I'm not even asking questions. I'm just trying to get a feel for what other people are saying and doing on those chat groups or those individual groups to find the answers that I'm searching for, or at least to get ideas on where to go to find those answers. The other thing is or some examples I want to give you of those groups are, for example, there's groups on kidney support, dialysis, transplant donors and recipients. Another one is caregiver support groups and multiple others. The next thing I'd like you to take a look at or just consider, this is not really on, you could find them on social media, but there are other groups out there in the world and on the internet. For example, the Renal Support Network. The web address for that is news@rsnhope.org. They have a great newsletter online weekly. Another one that's really good, and it's good for anybody who has any type of caregiving issue. For example, not just exclusive to kidney patients, but I think that the issues that we all face in terms of caregiving are common. You know, they come back to us no matter what disease or individual that you're trying to care for, whether it's a child, an adult, so forth. So this other group called the National Alliance for Caregiving is really good. They have a weekly newsletter that comes in my email, and they give you ideas on what's going on in the full scope of caregiving across many spectrums, many platforms as well. And how you'd reach that particular group is I would do a Google search for National Alliance for Caregiving and ask to join or sign up for their newsletter. It's free, doesn't cost anything, and it's really, really good resource for kidney patients and caregivers. Another group, for example, would be the Patient and Family-Centered Care Partners, more commonly known as PFCCP. They have monthly webinars on topics of important issues to kidney care. They're great because it's very topic. It's not just caregiving, but it's a lot of other issues that all of us face in dealing with kidney disease. And I found that very helpful. And it's not like you're required to sign in and watch every single webinar. You can do it at your leisure too, because they're archived. You can go back and pull them up at a later time when it's more convenient for you, because you all know our schedules are pretty darn full and packed. And asking family and friends, that's a big thing. And it's a difficult task to ask of somebody. But the way that I make it easy is to tell my story. And you need to tell your story. And the reason why, it makes it personal. It makes it easy to go to someone and ask them something if you're making it personal. If you make just a generic comment or a generic statement about something, it's going to go right over their head and they're not going to comprehend it more easily. But when you make it personal, you're tugging at their hearts, and it makes it much easier. What's the worst they can say after all? They can say no. And no shouldn't be a deterrent. No should just mean I'm moving on to the next person in line or the next thing in line. And you always want to remember that. And along those lines, keep in mind, to keep your sanity, you need to write things down. Keep things in a safe place, because with me, from a personal standpoint, when I kept things circulating in my mind and didn't write it down, it became so burdensome and so overwhelming that anxiety kicks in. And you're really nervous, you're worried, sleepless nights, and it brings on all the things that anxiety brings with it. Sleeplessness, worry, things that you shouldn't have to do. And this is an easy way to keep track of it. Not only by writing things down will it help you keep your own peace of mind, but believe it or not, it holds other people accountable. You can go back to them and say, well, gee, you said this at that place and time, or it reminds them that, yeah, I said I would do that, or yeah, I did do that. And if it leads to further clarification on things, writing things down also can lead you to use it as a resource in the future to help others. Just like I'm telling you what I do, hopefully this is helping you. And the last thing I want to tell you is it's really, really important, no matter what you do, what they do for you, as small as it might be, you always got to remember to say thank you. Thank you comes in many forms, and oftentimes I'll do it several different ways. I'll do it on social media, send a quick email or a thank you. But if it's something that they've done that's kind of important to you and it really helped you out a lot, what I would do is say thank you in the way of a card or a little quick note to them and send it off. And the reasoning behind this is, and always remember this, you never know when you might need to go back to that resource and tap that again. People remember those things, and it's also good for them too. It comes in a lot of different ways, that it might benefit them in their career, their aspirations to where they want to go, and it makes them feel better too. And it also opens up the door to people so commonly say, oh, if you ever need help, give me a call. Well, you're putting words to your thank you because you did need help, you gave them a call and they answered the call. So you need to say thank you. If you fail, never give up, because fail means first attempt in learning. End is not the end. In fact, end means effort never dies. If you get no as an answer, remember, no means next opportunity. Positive thinking. I'd like to thank you for taking the time to listen to me today, and I hope that I have helped you along in your efforts in caregiving. Feel free to contact me for my contact information I've provided initially. I'm always here to give a hand, lend an ear, and anything that I can help follow up with you on to help you out in your journey. Because remember, kidney disease is a journey. It isn't a one and done deal. It's something we all have to deal with day in and day out, and we need to take care of our loved ones. Thank you very much.
Thank you, Bobbie, for that awesome presentation. I have a question for you. Can you tell us why it is so difficult for some of our caregivers to ask their family members or friends or perhaps other loved ones for assistance, and strategies you have used to overcome this concern?
To overcome the difficulties in asking someone to help me, what I've done is try to make it personal. I've tried to put it into our story to tell people that what we're going through, what we're experiencing, how difficult it is for a young person to have kidney disease and to expect to start off in life and not have anything to go to simply because he's developed all of a sudden unexplained kidney disease. What I've done through telling my story, it makes it a lot easier for them to realize, and tugs at their heart to know that we're needing some help here. And then I make my ask. It makes it easier because you're feeling the difficulty that you're experiencing and you're trying to relay that to them. It makes it more difficult for them actually to say no too. Along those same lines, the strategy I used is that if I did get a no, and a lot of times I really didn't, but occasionally a no would come up that I'm too busy or I can't do that. I didn't let it deter me. I went on to the next person on my list. The most important thing I think here is you got to remember to keep a list. It's simple. And you always got to remember that when someone does help you out, you need to say thank you. That's a really big component of everything when all is said and done. Remember to say thank you, because the key here is the ask. If you ever have to go back to that person again or make that request on a second time around, people are going to remember that you said thank you. It carries a lot of weight in that regard.
Well, this concludes our session. At this time, I would like to thank again Ashley and Bobbie. On behalf of AAKP, we appreciate you both taking the time out to share your expertise and insight.